It should be in there.
After
Yeah.
reservoir infection.
Okay. Yeah, it's in there. So, so that's what a carrier is someone who does carry the pathogen, but they're not demonstrating any of the symptoms. So some examples of that is what we have here is Staphylococcus aureus without having a sore throat. This is somebody with a staph infection of their skin. Okay, it is bacterial. It causes skin infections, pneumonia, food poisoning, toxic shock syndrome, and also bacteremia. Another example of a carrier is that of typhoid Mary. You guys have heard my lectures before about typhoid Mary?
Mm-hmm.
Okay, prominent cook, upstate New York, okay, was contaminating all the food and everybody was getting sick. So it is bacterial from Salmonella. Fever and skin rashes cause also lethargy and also extreme abdominal pain, diarrhea, vomiting, and respiratory distress, and also brain swelling. So typhoid Mary, she was famous for doing that. All right. Are we good?
Yeah.
Okay. All right.
That's
That was cute. Okay, what's another example of a carrier? Bloodborne pathogen, for example, in relation to HIV and AIDS.
Needles? Or
Who was a famous carrier of HIV and AIDS and still alive
Magic
today?
Johnson.
Magic Johnson. Okay, remember Magic Johnson?
it was a curator.
He wasn't a carrier, he had it. He
He's a
didn't
carrier.
have it.
He's a carrier.
symptoms.
Yeah, he has it, but he's a carrier because he has it, but he doesn't have the symptoms. That's what a carrier
Or is
is.
it just because he's really rich, he has really good medication?
I
Well, yeah.
I don't know. There's a lot of rich people out there who
Big
have
guy.
this. That guy, yeah. Okay, so yeah, so that's another carrier. All right, so reservoir of infection. Number 2, the source or the reservoir of infection is any suitable place where pathogens can thrive in sufficient numbers. Okay, so pathogens, microorganisms, they like to live in warm, dark, moist places, and if there's ample nutrients, they can thrive and multiply. So warm, dark, moist. Warm, dark, moist, and plenty of nutrients. Okay? The source of infection can be a patient with hepatitis. It can be one of you guys with an upper respiratory infection. Lynn Handler with Staphylococcus boils. Again, that's how people in hospitals get sick, is us, from us. Humans are the most common or primary reservoirs of infection. The secondary sources comes from contaminated food and water or any damp, warm place that is not cleaned regularly. Okay, any questions so far? An exit portal. An exit portal from the reservoir can be the nose, the mouth, your GI tract, your urinary tract, and also an open wound. Okay? If you get a paper cut, can you still get an infection? Oh, sure you can. Okay, very good. All right. Means of transportation. The most direct way, and this is what we concluded earlier, the most direct way to intervene with the cycle of infection is to prevent transmission from the reservoir to the susceptible host. Some means of transmission includes direct contact, indirect contact, droplet, airborne, and also vector. When you guys go into the red taped room or the isolation rooms, are there signs out there to tell you what this patient has before you enter?
Yep.
Okay, are you familiar with these terms?
Yeah.
Direct contact, indirect, droplet, airborne, right? Okay. You should also be, there should also be carts where you can put on the PPEs. What's PPE?
Personal protection.
Personal protection equipment. Okay, so you guys know that. Very good. All right. So direct contact then is spread when disease-causing microorganisms pass from the infected person to the healthy person via direct physical contact with other blood or other bodily fluids. This includes direct contact from touching, kissing, sexual contact, contact with oral secretions, contact with body lesions, and also a needle stick. Okay? This is direct contact. Indirect contact is spread with an infected person. Sneezes, coughs, sending the infectious droplets into the air. Droplets generally travel about 3 feet and land on surfaces or objects, including tables, doorknobs, etc., etc. Basically, what this is saying here is now there is a middle player here. Remember, what direct contact is person to person. Indirect is someone who's infectious contaminates an inanimate object. It can be the table, it can be the telephone, it can be the handle to the Nordstroms. It could be the serving spoon at home buffet?
Oh God.
Hometown buffet.
If you're going there, you deserve to get sick.
Okay? That is indirect contact. Man, if you know, oh man. Did I tell you that's one of the places I don't like to eat is at a buffet?
Yeah.
Have you ever just sit there for just 5 minutes and watch what they do when they're getting their food?
Plantation, no, that's one of my favorite.
But you know, I got over that. I'm over it. So I go to buffets, but my whole
Just close
attitude
your
now
eyes.
is what doesn't kill me
Wear a blindfold or
is
what?
to make me stronger. Yeah, so I'm way past that. But you know, years and years ago, I was such a super germaphobe. I was afraid to touch things.
How'd you get over that?
Huh?
How'd you get over that? Most people don't.
I was actually getting crazy. I mean, I couldn't live a normal life. Seriously, I couldn't get a normal life. I was just like,
How did you work in the hospital, man?
Yeah, that's exactly it. You know, it got really hard working in the hospital, but I got over it. I just tricked myself. Yeah.
It's all in your head.
So the key here then so direct is person to person, indirect is person,
To fomite.
object, person. And that object, that contaminated object is known as a fomite. Okay, so any of those contaminated objects is known as a fomite. Now, this is where there's a little nuance to this, a little twist. Because if you look back here,
Needle stick.
needle stick. Okay, needle stick. It falls under direct contact, not indirect. It is direct. Okay? Now, this is not a trick question, but although it falls under direct contact, is this still considered a fomite?
Yes.
It is a fomite. Okay, so this is the only exception. Yeah, you guys remember this. Good. All right. I like that picture. Have you guys ever seen those videos?
Did you see
Slow
the
motion
show Where they
sneezing?
put the dye in their mouth,
Uh-huh.
and they sneeze and they measure how far it goes? It's those two guys, it's like the Mythbusters or
Oh,
whatever guys.
Mythbusters?
And dude, gross.
It's nasty. Well, I picked a real one that we can deal with because there were some pretty nasty ones on Google that was even worse. So droplet contact. So droplet contact refers to infectious secretions coming from the tear ducts, nose, and also the mouth. Examples of droplet contamination often occurs when an infectious individual coughs, sneezes, or even speaks.
Say it's
So
on
even
sprayer, bro.
speaking, yeah, even when you're speaking, you're spitting. So, yeah, that's why I don't like to have conversations with waiters and waitresses when they're serving food. I clam up. Just give me my food. I don't want to have a conversation with you. It's like spit. Am I getting you guys paranoid?
No.
I lived that
Not
life,
dead
man.
yet.
I was like in prison. Okay, so individual coughs, sneezes, or speaks in the vicinity of the susceptible host. If healthy people inhale the infectious droplets or contaminated droplets land directly in their eyes, nose, or even their mouth, or even their lips, okay, you risk the chance of becoming ill. So when we're dealing with droplet contact, and you'll see this again later on, your safe distance is approximately 3 feet. That's your safe zone when dealing with droplet contact, okay? So, there you go. Droplet contact. So airborne transmission then is an extension of droplet. Airborne transmission refers to inhalation of suspended evaporated droplets of disease microorganisms. So this is your safe zone right about here. And then it becomes airborne right after that. All right. Questions? Okay. Vector is any living carrier that transmits an infectious agent, usually insects. It says usually, so what does that mean? Can it also be plants?
Yes.
It can be plants, okay, but this generally applies to insects, but it also can be plants. So a vector in reference to insects include mosquitoes with malaria, fleas with the bubonic plague, and also dogs, and bats having rabies. Okay? If you heard this story, just bear with me. So I'm going to tell it to the other group. Do you guys know what the bubonic plague is? It was that plague that almost wiped out the entire Europe. Okay? And it came from fleas. Okay? So here's the irony. So they didn't have the CDC or all these different organizations to figure out where the disease was coming from. They literally had detectives, police officers, or whatever you want to call them, but they were detectives. So when this became an epidemic, okay, it was spreading like wildfire, people were dropping literally like flies, they said the infection is coming from cats. Did you guys know that story?
Yeah.
Mhm.
Yeah.
It was really the rats.
So they got rid of all the cats, found out it was the rats.
And if they had just left the cats alone, they would have eaten the rats.
Eventually, yes. So that was the whole twist. Yeah.
Stupid humans.
Stupid cats. Okay, portal of entry into a new host. Okay, so same way as it exits, can enter the same way. Okay, through ingestion, inhalation, injection, and across mucous membranes. Susceptible hosts are frequently individuals whose impaired health have reduced their natural resistance to infection. So again, we're constantly battling infections every single day, and we don't get sick because our body is really strong. But the moment that it becomes compromised, like not eating well, not sleeping well, stress, okay, those things can contribute to increasing your chances of getting sick. In addition to the primary problem that caused the hospitalization, secondary infections may also develop. Hospital-acquired infections pose a threat to the healthcare workers. Nosocomial infections occur during hospitalizations and medical procedures, as we had said earlier. They are extremely dangerous, and you can see this as a result of bed sores, different types of illnesses, and also even death. There have been an increased number of patients coming in, so this also may contribute to nosocomial infections because now ERs are so busy, they are not properly triaging their patients. They get them in, order the exams without proper process, and they are spreading the illnesses from one caregiver to the next, or from one patient to the next. And I can attest to this, and Mr. Benoit can probably do the same thing too, is when you get a call from the emergency room saying, we need a stat chest x-ray. Stat, are you guys getting those calls now? Stat chest x-ray. You do your portable. 30 minutes later, you get a call saying, oh, our patient has TB. Or our patient has scabies, or our patient has chicken pox. Okay? It happens all the time. They're triaging them, getting these procedures done without going through the proper protocol, and that's how people get sick. But they get so impacted, that's what happens, so they get careless. There has been a resurgence of TB and other diseases thought to have been wiped out. So remember what we said, a lot of these microorganisms, or pathogens to be specific, they may go dormant for a while. And all it takes is just a certain trigger to cause them to grow, spread, and get activated again. So now there has been a resurgence in TB. Urinary tract and bloodstreams are going to be the #1 route for these nosocomial infections. So, preventing disease transmission. Medical asepsis is the first line of defense in preventing the spread of disease by washing your hands. Following universal precautions. Wearing gloves and other protective wear and washing your hands after removing your gloves help prevent the transmission of infectious microorganisms. You guys can read through this on your own. I just put this up there just for s and giggles, okay? Have fun with it, okay? But the CDC, these are the guidelines of washing your hands, okay? Any questions? All right, so your immune system. Antigens are foreign or unrecognizable organic substances that invade the body. Antibodies are produced as a response, which builds immunity, found in tears, saliva, spinal fluid, and colostrum, or colostrum. What is that?
Breast milk.
Okay, mother's milk. Mother's milk, okay, good.
Booty milk.
And also, Also a vaccine, okay, which is an artificial immunity. But we also have autoimmune diseases. These are individuals whose own antibodies destroy healthy tissue, including forms of diseases like rheumatoid arthritis and also multiple sclerosis. The process of how these pathogens grow and how they spread, this is not to be confused with the cycle of infection. We're talking about the growth and spread now of these microorganisms. The first one here is the incubation stage. Do we have this on your slides?
No.
Okay, I'll go slow then. So the first stage here is the incubation stage. This is where the pathogens are dormant with no specific symptoms. They are dormant with no specific symptoms. Okay. Number 2 is the prodromal stage, where some symptoms start to appear, and this is the time when the individual becomes highly infectious. Okay. This is where the individual's immunity starts to break down, and now they're in the process of getting sick. Okay. Then you have the full disease, where full symptoms are appearing, and now they have a good chance of transmitting their sickness to somebody else. They become highly contagious at full disease. And a convalescent stage are the symptoms start to disappear. Some diseases go dormant at this time. Oh, nobody's writing, so I can keep going?
Mm-hmm.
Okay, good. All right. All right, so we have to cover this because we're going to be doing venipuncture. So 2 of the main pathogens or diseases that we'll be covering is HIV and also hepatitis. So HIV, human immunodeficiency virus, is a virus that causes AIDS. The virus may be passed from one person to another when infected blood, semen, and vaginal secretions come in contact with an uninfected person's broken skin or mucous membrane. People with HIV have what is called an HIV infection. HIV suppresses the immune system of the body and renders it unable to resist opportunistic infection. So HIV is the name of the virus. HIV renders your body's ability to fight infections. So when somebody gets that HIV virus, this is where the syndrome comes to play. This is called the acquired immunodeficiency syndrome. So when somebody gets ill and eventually dies from this infection or HIV virus, they're not dying from AIDS. AIDS is a syndrome. They die from that type of infection that they acquired. Does everybody understand that? So they die from the infection that they acquired, not from AIDS. So a person infected with HIV who does not develop AIDS may unknowingly transmit the virus to others. They're carriers, like Magic Johnson. AIDS demonstrated with a series of infections which are opportunistic in nature. And again, be careful in how you use your terminology. So know the difference between died from AIDS versus died from a result of complications from AIDS. Infectious diseases commonly seen in persons with AIDS includes pneumocystitis carni, herpes and skin lesions, and also AIDS dementia complex. These are just some examples. The bloodstream is a chronic carrier of HIV. The most common method of spreading HIV virus is by direct contact. Okay, no other means of transmission has been proved by direct contact. AIDS cannot be cured. Treatment is done palliatively, and are we familiar with that term palliatively means? Okay, so yeah, so we're no longer treating the disease, we're treating the symptoms. So when we treat a patient palliatively for someone who has the HIV virus, we're slowing down the progression of the illness. We're trying to prevent other infections from happening, and we're suppressing the symptoms. In other words, we're trying to make the individual's life as comfortable as possible. That's palliatively. HIV in the imaging professional, only 0.0016% of reported AIDS cases have involved contraction in the healthcare workplace. Nearly every case involved loss of atomic integrity. That just means a broken skin or broken membrane. This is something new. I took that slide that you had up there before because it's confusing, so I gave you guys a new slide. Okay? So this slide lists infectious and non-infectious body fluids as it pertains to AIDS and HIV. Okay? So this is the new list. It's right out of your manual. Okay? So fluids that are considered infectious includes blood, other types of body fluids, pus, semen, vaginal secretions, cerebral spinal fluid, synovial fluid, pleural fluid, peritoneal fluid, pericardial fluid, and amniotic fluid. Those that are considered non-infectious includes breast milk, sweat, nasal secretions, tears, saliva, sputum, urine, and also stool. Is this good for you guys to know?
Yes.
I think it's very important that you guys know this. In treating patients in the manner of assuming that they are all carriers and high risk, they must also be treated in the same non-judgmental and professional manner that you would not treat a non-AIDS patient. We talked about HIPAA before. This falls under that category of HIPAA. If that patient does not want you to let family members know that they have HIV or AIDS, they're in their rights for you not to tell anybody. Okay? However, there's that fine line that if by not sharing that information, it may be an endangerment to somebody else, that's where you have to break confidentiality. You understand what I'm saying?
Yes.
Okay. All right. Viral hepatitis. I got some new data, so I changed up the data on that. So hepatitis is a chronic inflammation of the liver. Hepatitis B is the most common form of blood-borne hepatitis and important to healthcare occupational pathogens. This is more prevalent in a healthcare setting than HIV. So this is what we should be more fearful of. I mean, you should be fearful of everything, but this is more prevalent than some of the other blood-borne pathogens. So HBV is 50 to 100 times more infection than HIV. Hepatitis C is second most common. You can get hepatitis from accidental needle sticks, tattooing, multiple sex partners, IV drug use, multiple blood transfusion, seminal and vaginal secretions, breast milk, tears, and saliva. And this may lead to other liver disease. Yeah, this is not like HIV. You can get it through these other types of bodily fluids, including tears and saliva, breast milk, and this may lead to other liver diseases, including cirrhosis and also liver cancer. Yes?
Are you talking to me?
I'm talking to anybody.
Would that be a red tape room? An
Would that be what?
Isolation room?
This is contact. This is definitely contact isolation.
Interesting.
Yeah.
What about sweat?
Sweat? No. Sweat, no. It should be red tape.
Okay.
Yeah. That's when we work in the cath lab. Whenever we get, it's usually the nurses and doctors who first know if the patient has hepatitis. So the moment that we bring them into the room, they'll pull the staff members to the back. While the patient's in the room getting ready, they'll say, patient has hepatitis.
That's exactly
Yeah.
what happened.
And then that's when we
After
know,
we
and then we
transport
enter the room, and now we're double gloving and triple gloving and putting on different things to prevent any type of infection. Yep.
They didn't tell her till after.
Yeah, they didn't tell us till after we transported him. And his hospital room was in
Okay.
isolation.
So what does that tell? So Kristen said they didn't tell her till after they transferred the patient. So what should you have done?
I washed my hands
No,
immediately.
before that. No, before that. Remember what we said, standard precautions. You treat every patient as if they have some type of infectious disease. Minimum requirement are gloves. Do you know how many times I said, whatever. I go to move a patient and all of a sudden I'm doing this. Because I touched something wet.
Oh.
Yeah.
Especially
Okay.
if you're
We luckily didn't
Yeah.
actually move him. We took his bed from the room.
Mhm.
Is it urinal?
So if I'm getting you guys paranoid, then I'm doing my job. Okay? Minimum requirements are gloves. All right, so in the US, approximately 8,000 to 12,000 healthcare workers are infected with Hep B each year, resulting in approximately 200 deaths. So,
I want out.
I'm out.
so what,
Kitty, finish your body.
what we have here are the bloodborne type of hepatitis. So B, there is no cure, but it is treatable. Hep C is curable. Hep D, there is no cure, but it also is treatable. Those are your different types of bloodborne hepatitis. Okay, but B is the most prevalent and most aggressive of the three.
What was your aunt?
Huh?
Your aunt or someone had a needle stick?
She got stuck with I think it was B. You guys remember me telling the story about my aunt? She got stuck by
She eventually got
a
cancer,
dirty,
right?
a dirty hepatitis needle. Yeah, and it led to it went from here to liver cancer in less than 2 years. Yeah, she got stuck. But she went through the regimen, so she reported on time. They gave her all the medications and therapy, went through this gamut of therapeutic treatments. But she ended up with liver cancer and ended up dying. I think she was 45 or 46.
Wow.
Yeah. She's my cousin. Okay, to prevent HIV and hepatitis infection, the imaging professional must. I think you have that in your slides, but I tweaked it a little bit because I think it just said HIV. I must include hepatitis. To prevent HIV and hepatitis infection, the imaging professional must follow the universal precautions for blood and bodily fluids. Follow barrier precautions for procedures involving contact with blood, mucous membranes, or non-intact skin of patients. Take extra care when dealing with sharp objects such as needles and scalpels to prevent injury. We will talk about this later on. In venipuncture, you should never, ever, 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 ever recap your needles.
Scoop it.
The moment that you are done with it, don't do the scoop. This is just, if you have no other choice. But what you should do with it is what?
Dump it.
Get rid of it immediately. Dispose of it. Okay? So we'll spend some time on that next week, Mr. Benoya? We'll probably spend some time on that next week. Avoid mouth-to-mouth resuscitation when ventilation devices are also available. So I pulled this from my other class here, but this is why you don't want to recap, okay? Because you do that and you get stuck. Now, if you have no other choice in recapping, you have safety needles now where you just kind of flip a cap and it covers the tip of the needle immediately. So those are readily available. But if you don't have that, this is one way of recapping your needle. It's the one scoop method. You're only using one hand. Okay, placing the cap on a hard object and scooping it up with the needle. Okay. Now, if I were to ask you a question, the one scoop method is acceptable, what are you going to tell me?
No.
It's still a no-no. Okay. So if I say is recapping acceptable, you're going to tell me
No.
no. Okay. Never ever recap. All right. Some other things that you'll come across was, did you say tuberculosis, the one that you had, or Hep C? Okay. Tuberculosis is another common type of disease that you will be running into. Tuberculosis is caused by spore-forming bacteria. It is an airborne contaminant. It's actually heavy droplet and airborne. Okay. You guys are familiar with this? Did you guys have to be fitted for that at your hospitals?
Not yet.
What?
We have to, but we haven't been fitted yet.
You better. Did you get fitted for it yet?
No,
You
we
have
haven't
to
been
get.
fitted.
They're special masks. They're form fitting because you don't want any gaps anywhere around your mouth or your nose. So eventually, you guys are going to get fitted for the N95, which is a TB mask. Okay, it's a particulate respirator in preventing any droplets or any airborne contaminants from going through the fibers of the mask. They're not like your regular masks. Okay.
So what do you mean like fitted? Like small, extra small, large?
They have different
They have different sizes. And what some places
so it's
do
not like
is
it's your mask that's like molded.
no. It's, no. They have to find the correct size for you. Yeah. And so they'll fit you with different size masks. And then what they'll do is they'll put on like a hood.